Chapter 21 of ICD-10-CM is for factors influencing health status and contact with health services. This presentation will cover the official ICD-10 guidelines specific to this chapter. There will also be clinical scenarios to practice coding what you just learned, followed by a small quiz at the end of the presentation. For each coding example, you will need to pause the webinar and use your ICD-10-CM coding manual to code the scenario. Once you resume the webinar, we will go over the correct codes, the rationale behind them, as well as how to locate them in the ICD-10 manual. Keep in mind that there may be more than one way to find a code. We are aware that there is a great deal of information contained in this presentation. Therefore, at any time during the webinar, please feel free to pause and replay as needed. It is important that you have already completed the Introduction to ICD-10-CM webinar, as you will use the conventions and general guidelines discussed in the introduction to complete the coding scenarios. As you can see on this slide, the codes for this chapter start with the letter Z. If you remember from ICD-9, these codes all started with the letter V and were known as the V codes, and they were supplemental codes found after chapters 1 through 17. In ICD-9, the V codes were considered supplemental, which is why they were located after all the numbered chapters. However, in ICD-10, these codes are no longer supplemental and have their own chapter number, which is 21. This slide contains different categories for this chapter, and they are very similar to ICD-9. Think of the old V codes as the Z codes of ICD-10. Z codes represent reasons for encounters when circumstances other than a disease or injury are recorded as diagnoses or problems. This happens when a person who may or may not be sick encounters health services for some specific purpose, such as to receive aftercare of a below-the-knee amputation. However, Z codes are not used for aftercare of fractures, as this is reported using the appropriate code for the fracture, with a 7th character indicate subsequent encounter. Z codes are also used for a person that is donating an organ or tissue, to receive a prophylactic vaccination, or to discuss a problem which is in itself not a disease or injury. Remember that if a procedure is performed, a corresponding CPT or HCPCS code must accompany a Z code. For example, a patient comes in for vaccination. Even though you're reporting the ICD-10 code for vaccination, you must also use the CPT and or HCPCS codes. The same goes for an ICD-10 code for birth control counseling. The appropriate CPT code must also be used, as Z codes cannot stand on their own. These codes are also used when some circumstance or problem is present which influences the patient's health status but is not in itself a current illness or injury. For example, family history of malignant neoplasm, so the patient is having a special screening performed, or personal history of a disease that requires continued maintenance, as with history of breast cancer. If you participated in the webinars for the obstetrics and perinatal chapters, you know that Z codes are also used for newborns to indicate birth status. Also, remember that when a current acute condition is being treated, a diagnosis or symptom code should be used, not a Z code. A Z code might in this case be a secondary code to provide additional information, such as a patient with a current stroke who also has a history of strokes. So the stroke code goes first, followed by a Z code for history of strokes. Even though many of the codes are similar from ICD-9 to ICD-10, with the exception that V codes are now Z codes, there are a few new features in ICD-10. The concept of blood type is now represented with specific Z codes for each blood type and Rh factor. Another change is that there are no more specific codes for the type of vaccine the patient is receiving. All those vaccine codes have been replaced by a single code, which is Z23, and counter for immunization. There is also generally greater specificity, such as routine exam with and without abnormal findings. If there are abnormal findings, they must be coded as secondary diagnoses. Now I want to try some Z-code examples. First, we have a 3-year-old boy brought to the doctor by his mother for his routine well visit. After a comprehensive history and exam, the physician notes a plantar wart in the assessment. A flu vaccine was also administered. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is Z00.121, encounter for routine child health examination with abnormal findings. This code must go first because it is the reason for the visit. It is appropriate to use this code because the plantar wart was found during the encounter. To locate this code, start at examination in the alphabetic index, then locate child over 28 days old, and then the phrase with abnormal findings indented below, which points to Z00.121, which you would then confirm in the tabular. There is a note in the tabular which states, use additional code to identify abnormal findings. Therefore, we know our abnormal findings have to be coded next. The next code is for the abnormal findings, which is B07.0 plantar wart. To locate this code, go to wart in the alphabetic index, then find plantar indented below, which points to B07.0, which you would then confirm in the tabular. Our final code is Z23, encounter for immunization, since a flu vaccine was provided. To locate this code, go to vaccination in the alphabetic index, then locate the phrase encounter for indented below, which points to Z23, which you would then confirm in the tabular. There is a note in the tabular here which states code first any routine childhood examination, so we know that Z00.121 has to go first. For the next example, we have an 88-year-old woman seen for continued follow-up for C. diff, which is Clostridium difficile colitis. Cultures of the organism have found this infection to be resistant to amoxicillin. A new drug regime will be started at this time. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is A04.7, enterocolitis due to Clostridium difficile. To locate this code, start at colitis in the alphabetic index, then find Clostridium difficile indented below, which points to A04.7, which you would then confirm in the tabular. The next code is Z16.11, resistance to penicillins. To locate this code, go to resistance, resistant to in the alphabetic index, then find organism, then to, then drug, and then amoxicillin, which points to Z16.11, which you would then confirm in the tabular. There is the note in the tabular which states code first the infection, so we know that A04.7 must come first. For the next example, we have a single newborn delivered vaginally in the hospital. The baby is being treated for Rh incompatibility. The baby has type B negative and the mother is B positive blood. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is Z38.00 for single live-born infant born in hospital delivered vaginally. To locate this code, you would start at newborn in the alphabetic index, which has the words infant and live-born and singleton in parentheses next to it, and then look for the phrase born in hospital, which points to Z38.00, which you would then confirm in the tabular. The next code is P55.0, RH iso immunization of newborn. To locate this code, start at incompatibility in the alphabetic index, and then RH, which has blood group and factor in parentheses, and then indented below find newborn, which points to P55.0, which you would then confirm in the tabular. Our final code is Z67.21, type B blood RH negative. Remember that we now have the ability to capture this in ICD-10, and it is relevant to this encounter because of the RH incompatibility between the mother and the newborn. To locate this code, you would go to blood in the alphabetic index and then locate the word type indented below, followed by B, and then under this is for RH negative, which points to Z67.21, which you would then confirm in the tabular. The final example is a patient seen for fitting of right artificial leg after patient had below knee amputation. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is Z44.121, encounter for fitting and adjustment of partial artificial right leg. To locate this code, start at fitting in the alphabetic index, then artificial, and then leg. There is an instructional note here which says see admission, comma, adjustment, comma, artificial, comma, leg. After following these directions, you want to locate partial, which points to Z44.12, with a checkbox indicating that more digits are required. When we confirm this code in the tabular, there are options for right, left, and unspecified in subcategory Z44.12, and therefore Z44.121 is appropriate for the right leg. And remember, one of the new concepts of ICD-10 is that laterality has been added, so we can now specify in I-10 which leg is being fitted. The next code is Z89.511, acquired absence of right leg below knee, to show the reason why the patient is presenting for the fitting of the partial artificial leg. To locate this code, start at absence in the alphabetic index, then locate leg, then the phrase below knee, which points to Z89.51, with a checkbox indicating that more digits are required. When we confirm Z89.51 in the tabular, we see that there are options for right, left, and unspecified in subcategory Z89.51, and therefore Z89.511 is appropriate for the right leg. You do need to pay attention to make sure that both codes are for the right leg. Since the reason for the visit was fitting of the artificial leg, Z44.121 should go first. Now it's time for our quiz. Our first question is, Z codes are generally more applicable in the blank setting. The second question is true or false. It is not necessary to assign a corresponding procedure code when assigning a Z code. The third question is, give me a scenario that would require the use of a Z code. You can pause the webinar to write down your answers and then hit play to find out if you were correct. The answer to our first question is, Z codes are generally more applicable in the outpatient setting. Things like preventive exams, smoking cessation counseling, and vaccinations. The answer to the second question is false. It is absolutely necessary to assign a corresponding procedure code when assigning a Z code. Diagnosis codes can never stand on their own, and payment is driven by CPT and HCPCS codes. Diagnosis codes are for the medical necessity of those services. The answer to the third question is Z codes are used for things like well visits, personal or family history of a disease, status post limb amputations, vaccine administrations, status post coronary artery bypass grafts, etc. Blood type is another one. Remember, the United States will begin using ICD-10 on October 1st of 2015. After the October 1st compliance date, it will be very important to verify that claims are being received and to check remits for denials based on the ICD-10 conversion. This concludes Chapter 21 of ICD-10 CM, Factors Influencing Health Status in Contact with Health Services. Please feel free to check out our webinars on all 21 chapters of ICD-10 CM. If you need further assistance with ICD-10 training for physicians and/or staff, please visit the VantagePoint website at www.vantagepointconsult.com or call us at 203-288-6860.